has been noted by researchers that fibroids affect about anywhere between 30 to 60% of women of African origin.
They might, of course, present with maybe weight gain, because these are huge masses which also, can lead to, weight changes.
It can also be an incidental finding. So you've gone to the hospital for any other reason, including just general checkup, and then you find that, yes, actually there's a fibroid that is present on evaluation.
Across Kenya, millions of women quietly endure the pain and disruption caused by uterine fibroids, a condition so common yet still so misunderstood. These non-cancerous growths in the womb can lead to heavy bleeding, chronic pelvic pain, bloating, and even infertility. For many years, the most commonly available treatments for uterine fibroids were hormonal therapy or surgical procedures such as myomectomy and hysterectomy, options that, while effective for some, often involved significant recovery times and could carry both physical and emotional burdens. However, advancements in medicine have gradually introduced a less invasive approach, offering women more personalized and less disruptive ways to manage their fibroids. But a new chapter is emerging. High-intensity focused ultrasound, or Hifu, is a groundbreaking, non-invasive treatment that uses focused sound waves to destroy fibroid tissue without a single incision. No hospital stay, no general anesthesia, just precise, targeted healing with a woman's womb and well-being preserved. While it might not be suitable for all cases, this innovation marks a major milestone. With only a handful of Hifu machines in Africa, Kenya's embrace of this technology is transforming fibroid care, offering women safer, modern options and a renewed sense of hope. In this episode, we meet the doctors leading this shift as we explore the science behind this quiet revolution in women's health.
My name is Dr. Moses Maina Ngoigo. I'm a gynecologist by profession. Fibroids, they are non-cancerous growths within and around the uterus that commonly affect majority of women, and especially women of African descent.
My name is Dr. Kirekio Manu. I'm a consultant obstetrician and gynecologist, and I'm also a senior lecturer at the Department of Obstetrics and Gynecology of the University of Nairobi. I'm a fertility specialist, so I help couples who have challenges in getting pregnant naturally, and also I'm the current president of the Kenyan Obstetrical and Gynecological Society. A fibroid is basically a growth which is not cancerous. And this is a growth on the womb or in the womb. And the womb is basically the uterus, and that is where babies grow, or that is where women also have a period. That is where the period comes from.
Studies on uterine fibroids in Kenya reveal a concerning but incomplete picture. A study conducted at Jaramogi Oginga Odinga Teaching and Referral Hospital in Kisumu found a 4% prevalence among women admitted to the gynecology ward, highlighting only the more severe symptomatic cases. Another Kenyan study focusing on women undergoing uterine fibroid embolization showed that 59% of them had more than 10 fibroids each, further underscoring the heavy burden among those seeking treatment.
It's common in our country. In fact, I dare say if you have to take 100 women randomly in the street of Nairobi or anywhere, and with no issues, and you do a scan, a pelvic ultrasound for them, we're likely to find 70 to 80 of them having fibroids of different sizes.
It has been noted by researchers that fibroids affect about anywhere between 30 to 60% of women of African origin. So it doesn't matter where you are, whether you're a Kenyan lady or whether you're an African American lady, wherever you are, you have that chance of about 30 to 60% of having fibroids during the reproductive period.
Several factors can increase a woman's risk of developing fibroids. Let us explore some of them.
Whereas there's not really one specific cause of fibroids, but there are those risk factors that are thought to increase the risk for fibroids. And key among them, of course, is genetic predisposition and familial predisposition, because sometimes you find that amongst some families, you find that sisters would have fibroids. So if, for example, your sister has fibroids, there's a higher risk of you getting fibroids as compared to someone whose sister doesn't have fibroids. But more importantly, it's been found that amongst women of African descent, basically women of black race, they have a higher prevalence or a higher risk of getting fibroids compared to the Caucasians and basically the Western woman. So the duration of exposure to the hormone called estrogen is an important risk factor for development of fibroids. So you find that for girls, especially who started having their menses maybe before 10 years, they are more at risk of getting fibroids as opposed to women who got menses maybe 14, 15 years. Of course, for those women who get their menopause later in life, maybe beyond 50 years, their risk is also a little bit higher than those who get earlier menopause. And basically, this is because of the duration of exposure to estrogen.
For our case, where we are really having many women getting into their career paths, and they want to achieve certain level of career before they think about family. So by the time they're reaching the ages of 35, 40, etc., they're likely to have uterine fibroids.
Of course, I have to mention the issues around obesity, lifestyle, things like alcohol consumption, all of which contribute to weight gain, obesity, increased estrogen levels, and all these contribute to fibroids development.
We think sometimes some of the foods that we take may probably be contributory, that are estrogen rich. However, that said, we don't have very clear, specific examples of those that we really want to mention per se.
Fibroids can present with a wide range of symptoms, though some women may have no signs at all.
So heavy menstrual bleeding is a big factor. The other thing, of course, is painful periods, what is called dysmenorrhea. Sometimes it's unfortunate that sometimes we have normalized period pain, but any woman who is having significant period pain should actually come for evaluation, because it could be fibroids, it could be endometriosis, it could be maybe adenomyosis. So period pain is also another, dysmenorrhea is another symptom that is common among women who have fibroids. The other thing, of course, is pain during sexual intercourse, what is called in medical circles dyspareunia. So if you're feeling pain during sexual intercourse, you need to come and get evaluated. Could it be fibroids? Because we know there's an association between fibroids and sometimes having this pain during sex. I must mention that some patients will also present with a lot of pelvic pressure symptoms. Now, pelvic pressure symptoms can include increased frequency of urination, passing urine. So you find maybe you're going to pass to relieve yourself maybe more times than you used to previously. Maybe per day you're going maybe 6 times, maybe in the night you have to wake up several times to go. And this is simply because when you have very big fibroids, the uterus is usually in close relation to the bladder, the urinary bladder. So when you have very big fibroids, they cause pressure symptoms, or rather they compress on the bladder, and therefore the bladder is not able to accommodate a lot of urine. You have to keep emptying the bladder, and therefore the frequency. In the same breath, the same thought, big fibroids also compress at the back, the rectum. So you find some women presenting with constant or frequent constipation in month in, month out. And sometimes it's basically because the rectum is being compressed by the size of the fibroid that has grown because of very big fibroids. Now, for young women and women who are desiring fertility, one of the main complaints is inability to conceive, because fibroids sometimes can cause blockage of the tubes, if especially they are close to the opening of the tubes. They can also distort the inner lining, what is called the endometrium. And of course, there are other mechanisms in which fibroids can impair fertility. And in that same, when I'm still talking about the fertility issue, there is a question of recurrent miscarriages, or what is called pregnancy wastage. So some patients will present with just recurrent wastage of pregnancies. They have maybe pregnancy losses at maybe in the first trimester, second trimester. And when you investigate, sometimes you find that maybe fibroids might be the culprit. For women who get very huge fibroids, sometimes they might of course present with maybe weight gain, because these are huge masses which also can lead to weight changes, or basically weight gain.
Fibroids can grow in different parts of the uterus. Some develop within the muscle wall, causing pain and heavy bleeding. Others grow on the outer surface, leading to pressure, bloating, or frequent urination. Some form just under the uterine lining, often triggering severe bleeding and even fertility issues, and in some cases, fibroids hang on a stalk, twisting and causing sharp pain. Now, how are fibroids diagnosed?
So diagnosis has two components. So one would be based on the symptoms. It could be because her monthly period has become heavier than usual, or they're taking longer than they are usually. She's probably felt that her tummy is becoming swollen. She finds that it's a bit firm. There's something that is swollen inside. And of course, it can also be an incidental finding. So you've gone to the hospital for any other reason, including just general checkup, and then you find that yes, actually there's a fibroid that is present on evaluation. Based on the history presented, the doctor would take his or her time to examine this patient, and there's what we call pelvic exam, where the doctor wants to just palpate or to feel the tummy and be able to really see, is the uterus the size it's supposed to be, or is this uterus bigger than it should? Are there some firm swellings on the uterus that can be palpated on the abdomen? That's what we are looking at. Of course, there are other components of examination that involve what we call vaginal exam. By the time the doctor has taken a good history, examined the patient, there's almost 90% chance that they're certain what the diagnosis could be. Okay? And so the next level is to figure out, can we confirm this diagnosis? So this 10% chance that it may not be, what else can it be? So that's where now we go into what we call imaging. And the commonest imaging that is probably more available, relatively affordable, and can be done without much struggle is actually a pelvic ultrasound. If you want to get a better characterization in terms of the size, the location, then even the number, which is more accurate, then there's an imaging we call an MRI. The 100% certainty that yes, the swelling that is present in this uterus is a fibroid is when that fibroid is probably removed and taken to the lab, so that we look at the cellular diagnosis, the laboratory confirmation that indeed what the mass was, or this swelling it was actually a fibroid and nothing else.
Coming up after the break.
Yes, it does happen. And this is something that we tell patients when they come to the hospital. Remember that when you do surgery, sometimes there can be a lot of bleeding.
Or basically the ablation to the fibroid. Now the ultrasound probe you can see here helps us to see the fibroids real time.
There is no cutting, so there's no scar to nurse.
Fibroids, a silent struggle that robs countless women of their health, their confidence, their work, and sometimes even their dreams. But with Hifu, an advanced treatment now available in the country, the outlook for fibroid care is set to change. Join us after the break as we dive deeper into this groundbreaking technology and hear directly from the doctors pioneering it here in Kenya. And now for a short healthcare tip. While the exact cause of fibroids isn't fully understood, research shows that certain lifestyle choices can help lower your risk or manage symptoms. Maintaining a healthy weight, eating a diet rich in fruits, vegetables, and whole grains, and reducing red meat and processed foods may help slow fibroid growth. Regular exercise also helps balance hormones, which play a key role in fibroid development. And most importantly, don't ignore the signs. If you're experiencing unusually heavy periods, pelvic pain, or bloating, seek medical advice early. Early diagnosis can open up more treatment options, including non-invasive ones like Hifu.
We are living in a lost and broken world, constantly bombarded by messages of hate and atrocities. But with God, we can overcome. Find hope and restoration on the go through life-changing shows on the Family Media app.
And then you will lose yourself and gain the world? And Jesus said, what good is it?
Get to stream Family TV and Family Radio 316 straight from your phone. Catch up on a show you missed or create video streaming playlists by saving and watching videos from our huge variety of shows at your own convenience. Download the Family Media app, available for all Android and iOS users on the Google Play Store and Apple Store respectively. Family Media, keeping Jesus on the airwaves.
Welcome back. Before the break, we explored fibroids, their causes, symptoms, and how they are diagnosed. Now we shift our focus to Hifu, a new cutting-edge technology available here in Kenya. But how does it work? Who is it suitable for? And what can women expect from the procedure? Up next, we speak to the doctors at the forefront of this medical breakthrough and hear firsthand how Hifu is transforming lives one woman at a time.
We have what is called high-intensity focused ultrasound, basically Hifu. So Hifu is a technology that uses ultrasound energy to ablate. So ablating in simpler terms is basically like killing, targeting a tissue with high energy to kill it off, what is called necrosis. So we use ultrasound energy to burn or basically to ablate a fibroid. Then it undergoes gradual shrinkage, and this is associated with the reduced symptoms or elevation of symptoms of the patient. So Hifu or non-invasive techniques is the mainstay, is the main thing at the moment.
Now let's take an in-depth look at the Hifu machine, how it works, how it targets fibroids, and why it is being hailed as a game changer in fibroid treatment.
Talk me through the Hifu machine.
So this is the Hifu setup. So basically this is the Hifu machine. It's called JC300, and that is to mean that there have been different generations of this machine. They have been improved over time. And basically this is where a client lies during the Hifu procedure. So inside here you can see we have what is called a water tank. So water flows from a tank from that side. It's called degassed water. It's been degassed through processing there and comes to this reservoir. Within this, you can already see that there is a transducer and an ultrasound probe. So the purpose of this is basically the transducer is what emits ultrasound waves and converges them to a particular point, which is basically the ablative point that causes the thermal damage, or basically the ablation to the fibroid. Now the ultrasound probe you can see here helps us to see the fibroids real time. As you're going to see on this panel, there are screens that transmit exactly what is happening here, so that we can be able to see the fibroid on the screen. We can be able to see the ablative point. It basically operates like a cyber knife. So you can see that ablative point, and once you're satisfied that it's a safe fibroid to treat, and in terms of safe, I mean the intestines are away from the treatment zone or the treatment area, you can be able to fire energy as multiple times as is necessary to actually ablate the fibroid. So the client lies here with their belly, what is called prone position, for about 2 hours. In this time, we are able to move the bed up and down, back and forth, and even this transducer can be moved in different directions. It's multi-directional. It can go right, left, up, down, and also towards the head side and also towards the foot side. And the whole control is on that panel. So after treatment, the client will walk to the recovery room, because as you would imagine, this is energy-based or heat-based treatment, so they have to go for some bit of cooling. But even during treatment, the skin of the patient is in contact with cold, degassed water for two purposes. One, for conduction of the ultrasound waves, but also more importantly, to protect the skin of the patient during treatment. So the treatment itself can take maybe about 2 hours, depending on the number of fibroids, the size of the fibroids, but also more importantly, the vascularity of the fibroids. And that is the reason why before we even conduct this treatment, we have to do a suitability evaluation, what is called simulation, to determine, number one, what's the size of the fibroids, what's the location, what's the vascularity of these fibroids, and how safe is it to treat these fibroids using the Hifu technology.
Who is best suited for this treatment?
Yeah, so we assess our patients for suitability because not every client is a candidate for Hifu. So to start with, clients who we recommend this treatment are those clients who have symptomatic uterine fibroids. Because clients who do not have, they don't have symptoms from the fibroid, they just have incidental fibroids that have been found incidentally, they do not need treatment. So for those patients who have big fibroids and multiple fibroids, and probably they also desire fertility, those are good candidates for treatment. Secondly, this treatment is best for especially young women, those who are in their 20s, 30s, and maybe 40s, because these are women who desire fertility, and we know that treating fibroids using this technology confers the benefit of the fact that you can actually conceive and even have normal deliveries even afterwards. Of course, the women that we give a nod to do this treatment are those who are also clinically stable. So let's say if you have other conditions, for example, heart disease, uncontrolled hypertension, diabetes, we also have to request you maybe to see your physician to stabilize your condition before you come for this treatment. For women who have low blood levels, sometimes this treatment can be probably considerable as compared to open surgery, because it has no blood loss, and other treatments would have blood loss where you have to build your blood levels first of all before the treatment, or maybe you might need transfusion even prior to treatment. And because this treatment does not cause any blood loss, sometimes women who have maybe hemoglobin levels of 8, 9, or 10 thereabouts, you can still recommend this treatment because they are stable enough to undergo treatment, and the risk is not very significant in terms of treating as compared to conventional surgery. So we assess based on the size of the fibroid, the number of the fibroids, the location of the fibroid within the uterus, the vascularity, how vascular are these fibroids, and therefore that means that before treatment, we usually have to do a pelvic MRI to assess those factors I've said, the size, the location, the number, the vascularity. Now, very small fibroids are not very good candidates for this treatment. And by very small, I mean fibroids which are less than 2 centimeters. Because when we treat, we have to ensure that all around the fibroid, we have to leave a margin of about 15 millimeters, a safety margin. Because you remember, we are giving energy, thermal energy, and we don't want this thermal energy to spread to other surrounding organs to avoid destroying other organs. Because at the end of the day, we want to treat, but we also want to maintain safety. And we say that this machine ablates to a width of 5 millimeters every time you fire the energy. So you see there's 5 millimeters where you are ablating, and you have to maintain a width of about 15 millimeters around the fibroid. So fibroids bigger than 2 centimeters and above are probably the best candidates. Very big fibroids are very good for, this treatment is very good for those fibroids because you can treat them with the certainty that you have a good margin of safety. Yeah, and of course, there are now those other parameters I've mentioned, how you can assess the suitable fibroids for treating.
Though rare, a woman can lose her womb during fibroid surgery, especially if complications like severe bleeding occur or if the fibroids are too large or too many. We speak to Dr. Kireki Omanwa, President of the Kenya Obstetrical and Gynecological Society.
Yes, it has happened. And this is something that we tell patients when they come to the hospital. Remember that when you do surgery, sometimes there can be a lot of bleeding, and especially when we are removing these fibroids, because they have extra vessels which feed the fibroid, as it were. So it does happen. It has happened to me several times where I had to make that decision, whether it is either to take care of the patient and make sure that she survives and goes home, or leave the womb and unfortunately end up with a mortality. The answer is obvious. So you make a decision on the table, but before that, what we normally do is we work proactively. That is, when the patient comes, before she goes to theatre, she needs to sign a consent form that I have been informed this is the type of surgery that I'm going to have and what are the possible consequences. Now, in that consent form, we agree that yes, my aim is to remove the fibroids alone. However, if there is excessive bleeding, then the patient agrees for me to proceed and remove the womb to save her life.
Now, for the women who perhaps still want to have children and don't want to lose a uterus,
Yes.
is a Hifu,
Yes.
is it then a better option for them?
Actually, it is the best option for them, I would say that. In terms of patients who have issues with infertility, number one, because of fibroids. Number two, don't want to have open surgery or laparoscopic surgery. Number three, for whatever reason it is, then I think Hifu is one of the best options for them.
As a nation, what is working well, or what maybe has the government done to support women and their fertility issues more, and also what more can be done?
I think I'll start with the second one. What more can be done? A lot more can be done. A lot more can be done. What do I mean by that? I mentioned that in Kenya we have about 700 or so consultant gynecologists and obstetricians. What more can be done? We can train more of these, such that we have a number which is a satisfactory number in all the counties. Remember, WHO actually assigns and says a doctor should be one doctor to several thousand, 4,000, 6,000 patients. But in this part of the world, we find that you have a doctor to about 20-something or 30-something, even 50-something thousand patients, and that is the general doctor. When we come to specialists or even subspecialists, you find that the proportions are out of this world. So, number one, increase the number of experts, and that is the human resource. Number two, create awareness. Actually, what we're doing is actually creating awareness, which is a good thing, because then people will know about fibroids, people will know about methods of treatment, then they can also go to their doctors and ask about some of these methods of treatment. Number three, affordability, availability, accessibility of these services. So yes, the government is doing what it can, but it can do a lot more. But here we're talking about the national government, and then there are the county governments. So both of them should work in tandem to be able to provide, these services. Are they doing so? To a certain extent, but it's not optimal, but to a certain extent.
Fibroids can be managed with medication to control symptoms or through procedures like myomectomy, which removes the fibroids but preserves the womb. A hysterectomy, a more severe measure, which is removal of the uterus, can also be done. Other options include uterine artery embolization, which shrinks fibroids by cutting off their blood supply. Hifu, however, offers a number of benefits, which may be the reason why more women are opting for this form of treatment.
There are patients who may not be fit for surgery. In that case, you want to go for non-surgical options, for example. So Hifu is a technology that has been in existence for a long time, from the 1980s. It just that we've been slow to really pick it up. But I'm glad that we're no longer just reading about it in books and conferences. We are able to have it done here, locally, in this Nairobi, in the center where we are. So it has a number of advantages that it poses to the patient. So one, there is no anesthesia. There's no being made to sleep, okay? With, of course, the risk that comes with anesthesia, all right? Though if we do it under what we call sedation and analgesia, we take care of the pain and make the patient comfortable, but we want the patient to be awake. There is no cutting, so there's no scar to nurse. Because there's no cutting, there's no bleeding. So these are patients who are undergoing a treatment where there is no scar involved, there's no bleeding, no blood loss. It's a procedure that is done the same day. The patient goes home the same day and resumes work within a very short time. Okay? Now, it allows the patient, because the uterus is still intact, so one, we're preserving the uterus. Okay? Number two, we're not having an incision on the uterus. So even the chance, the issues of getting pregnant, carrying the pregnancy, and even the delivery, the risks are much, much lower compared to where there's actual surgical intervention. So Hifu is here because it is a very critical technological option for our patients. Very effective in controlling symptoms, very effective in reducing the size of the fibroids, and therefore the patient gets benefit from that technology.
With Hifu, it's also reproducible in the sense that, repeatable actually, and reproducible in the sense that if you undergo a Hifu session or Hifu treatment, for example, today, you could still have this session in the future, because we know fibroids are known to recur. And we know the recurrence rate of fibroids ranges from around 10% to 30% with conventional surgery, and about 15% when you do Hifu. But if you are to undergo treatment again in the future, the risks are additive. The risks are increased in subsequent surgical techniques as compared to the initial surgery. For Hifu, if you've been done Hifu treatment for fibroids, even if you need another session in the future, the risks are not multiplicative, or they do not add on to prior risks.
Fibroids, a condition that has weighed heavily on the lives of countless women, often in silence. But with advancements like Hifu now available in Kenya, the future of fibroid care is looking brighter, offering women safer, less invasive options and the chance to reclaim their health without losing their womb. As we've seen today, technology is transforming the way we approach women's health, one breakthrough and one story at a time. Thank you for watching. Until next time, stay informed, stay empowered, and take care of your health.